can I have one time tonight? God is good and God is good all the time. My name is Irvin J. Spiritual Right. We give you a little short news on tonight. Um, I'm gonna talk about COVID. COVID really ain't never left. It just had calmed down a little bit. But now a new surface had come occur on the COVID. So they found something new. Parallel on COVID symptoms to watch out for as new strains identified in the United States. So they found something new. So new strains of COVID-19 have been detected, in the United States, and the public is being asked to look out for the symptoms. Known as Puro was detected in Michigan, was the first detected on July the 24th. So they noticed this in July the 24th. It was also found in the country of July the 31st. So they've been coming across this new symptom right here in July last month. So the same day it was discovered in Israel. So the first case in the United States was also detected earlier, this month, and yet there is no sign that this new strain is more harmful than those that which have been detected previous. Although it is though it might be more, they gonna look out for it. They say it's not that dangerous, but it's something new that they're still looking into it. So the Center of Disease Control, say they are tracking this new the new system right here, the new strain of the COVID. They're tracking it, for virus that causes the COVID. So it's some kind of virus, it causing the COVID. So they is getting more information on this matter. So in the meantime, I advise all Americans, to start back wearing your mask. So you got something new out there going on now. So we don't know how this new thing. They're still getting information on this new stuff that's causing the virus. So we want to still be careful. We don't want to just spread and start killing a lot of people like it did before. We have calmed down a little bit with the COVID. So the COVID is still here. They found new symptoms. So it never had went away. It just had calmed down. So a new strain has been identified in the United States of COVID-19. So look out for the system peer roller. Continue on washing your hands, on a regular basis, wearing your mask and use sanitizer. And I also have some COVID tips from when we first had, had started getting the COVID, COVID-19 tips to be careful following these steps. So one, keep a daily routine, by watching what you touch, like the doorknob or any other things that you will come across that you touch it, even if you're on a bus or the train. Trying to be careful, like bad touch it, or either have sanitizer. I keep sanitizer in my purse on my work bag. Sooner you get off the bus or the train, you need to sanitize your hand and try not to hold a railing for too long. So two, wash your hands regular, wear your mask, and use sanitizer. Try to keep sanitizer in your purse. So three, eat healthy meals. Drink plenty of water, fluids, drinks, or either like vitamin C, have vitamin C and vitamin water. So drink water or either something with vitamin C in it. Because if you do come across something, you want to try to fight it off. So you want to still eat healthy, drink a lot of water. If you do come across something, wash your hand thoroughly. Take everything you had on and make sure it be washed in a washing machine. Drink plenty of water and eat healthy, because it's all about your immune system. I know I have a low immune system, low iron. So about your immune system, if you could keep that up and stay healthy, you can kind of fight it off. So, folks, stay physical active. That's what I would just say. Like work out, eat healthy, drink plenty of water. If you can keep your immune system up to a good level, you can kind of fight a lot of stuff off. Drink plenty of orange juice. That's what I say. Anything with vitamin C in it, to keep your immune system up. So 5, be careful not to put your hands in your face. I know I have a habit of doing that. So you got a habit of putting your hands in your face or doing anything, try to be careful, because if you haven't got to the water to wash your hands yet, you're touching on the chair or you can touch on anything that's coming across your way and you put your hands in your face, so you got to be careful with that. So 6, separate from others in a close gathering, like the restaurant, the store, the bus, train, and etc. So the COVID slack up a little bit. I still carry my mask and still wear my mask like if I'm getting on a bus, the train, if I'm sitting in a restaurant waiting on my food or whatever. You want to keep your mask on until you start eating, and not sit so close to someone, because we have to do these things because I still was wearing my mask because they never said COVID was over with. It just said died down, with the killing and the severe of the COVID, it just said died down, but they never said it was over. So I never had stopped wearing my mask, never stopped carrying, So the next thing we're gonna talk about, the flex card for citizen, Medicaid. This is a card, that you can make groceries with. You can go in the store with, so this is a medical advantage plan. They give some American flex on spending card. Millions of Medicaid recipients are now eligible, to get a flex card with an annual spending limit. But yet many may not know about it. That exists. So this card can help because some of the citizens, they get Social Security, and sometimes their food stamps don't be enough. So this will help out. Plenty, it'll help out real good of them getting food off this card. So Medicare Advantage plan are helping eligible Americans to get benefits that they deserve and can be used for medical visit. So this is a card y'all need to apply for. You have to be 65 on up. So prescription drugs, dental, vision, and hearing. So this card gonna have enough money to take care of all of this. You have to see if you're eligible. You have to set up the flat card, for citizen, nation wide help. And there are a number for you can call to contact a speaking live agent. 844 955 0332. 844 955 0332. Now that's an agent you can speak with to try to see if you're eligible first. So Medicare Advantage Plan Flex Call Program. This is a program for citizens, and I think this is a good program because these days they still need help. They don't get too much food stamp. They don't get too much help on Medicare, none of that. So that's why President Biden, he came up with a plan for the insulin. So he made it eligible, affordable, for them to purchase their insulin. So I've been talking about hurricane lately. We had Hurricane Hurrica. So this is hurricane tips checklist. So 1, have an emergency kit. So 2, locate the nearest shelter. So 3, write down emergency numbers and keep them on the refrigerator. And also lock it in your phone. Make sure you have 2 phones fully charged. before the power go out. So, so folks, have your wallet, your phone, and your keys near you. You know, that's the three important things you need on you at all time during the storm. You know, they have the wraparound purse. You know, you can wrap that around you, and you have your phone, your keys, you know, in your wallet in that wraparound purse. You know, so it'll be on you at all time when you're moving around and have to run out the door. You know, so five, household batteries. You know, flashlight and radio. You know, because it's hurricane season, so these are some good tips that you could try to pick up. I'm gonna try to start getting this stuff now early. You know, so I'm gonna try to get batteries and flashlights and all this, the cameras. I'm gonna try to get all this stuff now. You know, so six, the best light to use, the one that's stamped on the wall. You know, it light up and you can place it on the wall. That's what I had, and that's pretty much good. You don't have to worry about the candles, you know, setting the house on fire, dropping, falling down. You get the one run by battery, you stamp that on the wall, and you're good to go. You know, so seven, a generator. Now, I know a generator is dangerous. You know, the generator makes sure it's outside, you know, away from the house. You know, it's not safe inside your home or either too close to your house. You know, it had to be a good little feet away from the house. Food, eight, food and water, sandwiches and tuna, something you don't have to warm up. Sandwiches and tuna and snacks, crackers, you know, something that you don't have to warm up. You know, so if you have pets, you know, pets owners, you know, you have to find a shelter. You know, they say you got to evacuate, that means you have to get ready for your pet. You know, so your pet, you have to find a hotel that will accept the pets, because some hotels don't accept pets. You know, so you got to start looking into who's gonna accept your pet. You know, who accept the pet or out of town friend or relative. You know, where you can take your pet and evacuate. You know, that's another thing. When you got pets and you got to evacuate, it's hard for you to evacuate with dogs. Some people I know have 3 and 4 dogs. You know, so important document. Place it on a high top shelf. You know, like your birth certificate, your marriage license, all that stuff. And you feel, you can bring it with you if you can. And they tell you evacuate. Bring it with you. Don't leave it at the house. You know, because you leave it at the house, 9 out of 10, you don't know what's going to happen, you know. So, the pets try to find ahead of time hotels are going to accept your pets, you know. Have your mercy kit, you know, find your near shelter, you know, sanitize your hands. You know, try to bring some sanitizer. So I mean, you're going to have sanitizer in your wraparound purse. You're going to have your wallet, your phone, and your keys. You know, that's all you're going to need when you have to get on the run. You know, so that's all the short news I have for you today. We talk about the hurricane tip for the checklist. We talk about the COVID. The COVID never had left. They're coming up with new systems, you know, so you want to continue on wearing your mask. Continue on washing your hands and using sanitizer. You know, so we also talk about this flex card on Medicaid, you know, for citizens. I think this is good. Medicare Advantage plan. You know, so I think this would be real good, you know, to help them out with food, household stuff, you know, because they get monthly check, you know, so they don't have too much food stuff to try to stock up on food and households, you know. So that's all the show news I have for you. Oh, and I also give you the number. I give it to you again in case anyone that's had missed it. You can call the agent and see if you qualify. You have to be qualified first before you set up. 844-955-0332. 844-955-0332. That's to speak with an agent. You know, so y'all have a blessed and safe day, and I'll see y'all in the next video.